As February is American Heart Month, and according to the Centers for Disease Control, heart disease is the leading cause of death for women in the United States.
But there are some ways to prevent heart disease. Here with some tips is Dr. Fergus, a cardiologist at Mount Sinai Hospital. Thank you so much for being here.
My absolute pleasure to be here with you early this Sunday morning.
Absolutely. So we're really talking about the Go Red for Women Day on February the 7th. We all need to be wearing red.
Absolutely.
Tell us why.
It's a reminder about heart disease in women, which is typically underdiagnosed, and women present differently. So it's sort of a campaign to bring awareness of heart disease in women.
Let's talk about how women present differently. What are the signs? Because it is different than men. We usually think pain in the chest or something, but how do women present?
Yeah, so the typical presentation is what we call the Levine sign, which you just described. Women may not have any of those symptoms. They may simply be tired. They may feel like they're having a cold, or it may feel like something like in their stomach or something like that. So their symptoms are atypical and a little bit sort of not natural compared with what you typically find in a textbook. So people need to be aware of that, and if they just don't feel right, seek help from a doctor or go to the emergency room.
At what point, though, when you feel those, because those sound pretty general.
They sure do. They sound general.
That you say, hey, this is a problem, I need to go.
I think if it's pervasive, if it, you know, everyone gets tired, because I'm sure you two do a lot of things, right? Busy women, shopping, taking care of their children. But if you feel pervasively tired, sort of above and beyond the norm, you're just not feeling yourself, you can't put your finger on it, and you can't figure out what made you so tired, then you seek help, because it's, you know, it's not natural to your daily routine. So that's sort of what you think about.
Yeah, something you cannot ignore. And you know, when you think of the leading cause of death in women, you really think of cancer, but it's not. It's heart disease.
Right.
And I know that the statistics are much different for women of color.
Oh, absolutely. I just want to go back to what you talked about with breast cancer. Most women are afraid of breast cancer, and it's on the rise. It certainly is. But do you know that a lot of the risk factors for heart disease are the same for breast cancer? So women need to be more aware, though, of heart disease, because typically you may die suddenly. Breast cancer, it's prolonged, and that's why people are more aware and they're more afraid. But heart disease is 80% preventable. The American Heart Association does a lot of research, and we recognize that many of these signs and symptoms, and in terms of the risk factors, they are preventable.
And so what is it we need to do, like the one big step that people need to take?
Yeah, people need to know their numbers. Know their blood pressure, know their cholesterol, know their blood sugar. If you have a family disease, history of heart disease, you should know that, and you should start earlier to get screened, to see your doctor, to get your numbers checked. Make sure you're physically active. The American Heart Association recommends about 150 minutes of exercise each week. That's very simple. 30 minutes on most days.
All right.
Stay active, and of course, don't be stressed. That's the big one.
There's a problem.
I know that. And just for women, we really have to put ourselves at the top of the list.
Absolutely.
You know, because we oftentimes put ourselves at the bottom of the list. Yeah.
A lot more self-care.
Absolutely.
Yes, absolutely.
Doctor, thank you so much for being here.
Great being here with you this morning.
Yeah. And all this great advice will be on our website, cbsnewyork.com.
CBS 2 News Sunday morning. We'll be right back.